The most important thing you can do to prevent aortic disease is to stop smoking, eat healthy, and exercise. Hi, I'm Dr. Kim Dela Cruz, a Mass General Brigham cardiac surgeon. So what is aortic disease? The aorta is the largest artery, the main blood vessel that carries blood from your heart to the rest of the body. Aneurysm is the most common type of aortic disease. It's an abnormal enlargement of the aorta that could be a bulge on the side of the aorta. The normal aorta has a 3 centimeter diameter. If an aneurysm has a diameter of 4 centimeters or more, then it needs to be monitored. The layers of an aneurysm can split such that instead of having a single channel for blood to travel through, there are 2 channels, a true channel and a false channel. This is called an aortic dissection, or the aneurysm can rupture altogether, causing internal bleeding. A rupture and/or dissection is a life-threatening medical emergency. At any point, the aorta could enlarge or have a bulge. There are 3 types of aortic aneurysm based on location. Thoracic, located in the chest, abdominal, located below the chest in the abdomen, and thoracoabdominal when the entire aorta is enlarged from top to bottom. This is the riskiest kind of aneurysm. The aorta is shaped like a candy cane. The short end or handle starts in the middle of the chest and is attached to the pumping chamber of the heart. The part of the aorta that leads up towards the head is called the ascending aorta. At the level of the left collarbone, the aorta curves towards the back of the left chest. The curved portion is called the arch of the aorta. That's where the branches going to the head and arms come from. The part of the aorta running down the back of the left chest is called the descending aorta. The aorta continues down towards the abdomen, pierces the diaphragm, and becomes the abdominal aorta with branches going to different organs in the abdomen and kidneys. It ends at the belly button before it divides into the arteries that go through the legs. Other types of aortic disease include blunt aortic traumatic injury, which is often caused by car crashes or falls, and aortic stenosis, a narrowing of the valve that is attached to the aorta, in between the heart or pump and the aorta itself or the pipeline. The aortic valve's function is to prevent backflow of blood into the heart. As we age, the aortic valve may narrow because of calcium buildup, making it harder for the heart to pump. But we're going to focus on aortic aneurysm. Risk factors for aortic aneurysm include hardened arteries, atherosclerosis, smoking, high blood pressure, and high cholesterol. Genetic conditions including Ehlers-Danlos syndrome, Marfan syndrome, and Turner syndrome. Is there a screening test for aortic aneurysm? Yes, we use ultrasound to screen for aortic aneurysms. We recommend screening if you have a parent, sibling, or child with a condition, or if you have Marfan, Ehlers-Danlos, or Turner syndromes. We recommend screening for abdominal aortic aneurysm for men 65 to 75 with any history of smoking, men 65 to 75 with heart disease or a family history of aneurysm, and men and women over 75 with a close family member with a history of aneurysm. Other tests we use to diagnose aortic aneurysm are MRI, CT angiogram, and echocardiogram or heart echo. What are aortic aneurysm symptoms? Many people have no idea they have an aortic aneurysm. If you do have symptoms, they may include difficulty swallowing or breathing, shortness of breath, a full feeling even when you don't eat much, hoarseness, chest, abdomen, or back pain, and swelling in the neck, face, and arms. Men are more likely to develop an aortic aneurysm. However, women have a higher risk of ruptures. How is aortic aneurysm treated? All aneurysms are potentially serious. Thoracic aortic aneurysms are the ones most likely to dissect or split. But both thoracic and abdominal aneurysms are more likely to rupture as they get bigger. For smaller aortic aneurysms that don't grow quickly, we recommend careful monitoring by a primary care doctor, cardiologist, or heart surgeon. Every year we use imaging to check your aneurysm. If you have high blood pressure, we'll get it under control with medication. And if you smoke, we'll help you find the resources you need to quit. You may need surgery if a thoracic aortic aneurysm is larger than 5.5 centimeters. We may also recommend surgery for smaller aneurysms that grow quickly. Types of surgery we perform are open aneurysm repair, a major surgery where we remove the aneurysm and replace that part of the aorta with an artificial graft, and minimally invasive endovascular repair, which may use smaller incisions or just a groin puncture. This involves a shorter hospital stay, less pain, and a shorter recovery. To prevent aortic aneurysm, quit smoking, eat a heart-healthy diet, stay active, keep your blood pressure and cholesterol under control. If you have an aneurysm that's being monitored, your doctor can advise on special considerations. For example, you may need to avoid medications that may cause aneurysm to grow, avoid certain exercises, eat a high-fiber diet, stay hydrated, and take stool softeners or laxatives for constipation. A recent study showed people who have surgery to treat a thoracic aortic aneurysm live just as long as people without an aneurysm. This is really good news. Make sure you see your doctor if you're at risk or notice any symptoms. Thanks for watching. I'm Dr. Kim De La Cruz. To learn more about other types of heart and vascular disease, click here and don't forget to subscribe.